The information provided is for educational purposes only and should not replace the advice of a doctor.
Hello, my name is Eliza and I'm a health coach for the City of Austin.
And my name is Kim. I'm also a health coach for the City of Austin.
Today we're going to talk about the importance of knowing your health numbers. At the end of your biometric screening, you'll receive a pamphlet that looks like this. These numbers indicate risk factors for heart disease, stroke, and/or diabetes, which can be prevented with healthy lifestyle behaviors. The first indicator on here is body mass index, or BMI. This is a comparison to your height and weight. A BMI between 18.5 to 24.9 is considered optimal. A BMI between 25 to 29.9 is considered overweight, and over 30 is obese. Risk factors of a high BMI include inflammation, strain on the heart, and thickening of the artery walls. However, weight is not the only indicator of good health. There are other factors to consider, such as waist circumference. A waist circumference of 40 inches or less for men and 35 inches for women is within range. Waist circumference is a better measure of health than BMI because it measures fat around the organs, which is a risk factor of cardiovascular disease. The next indicator we'll discuss is blood pressure. The first or top number is your systolic blood pressure. This indicates how much pressure your blood is exerting against your artery walls when your heart beats. Your diastolic pressure, the lower number, indicates how much pressure your heart is exerting against your artery walls while your heart is resting between beats. A normal blood pressure is within the optimal range of less than 120/80. The good thing is that blood pressure and weight can be improved with lifestyle modifications, such as reducing sodium intake and getting regular exercise. These positive health behaviors also impact our cholesterol, which Kim will discuss with you.
Like high blood pressure, high cholesterol itself does not cause symptoms. So if your cholesterol level is too high, you may not be aware of it. This is why it's important to get your cholesterol levels checked regularly. Talk to your doctor about how often you should have your cholesterol levels checked. Total cholesterol is a measure of the cholesterol in your blood. It includes the LDL, known as bad cholesterol, HDL, known as good cholesterol, and triglycerides, a type of fat that circulates in the blood. A total cholesterol level of 200 or more indicates high cholesterol. An LDL level below 100 is considered optimal or ideal. An LDL of 160 or above indicates an increased risk for heart disease. An optimal HDL level is over 60, whereas an HDL level of lower than 40 is considered high risk. The lower your HDL, the higher your risk for heart disease. A triglyceride reading of lower than 150 is considered optimal. Of course, interpretation of cholesterol values must be individualized, taking into account all of your risk factors for heart disease. A diet high in fiber and low in saturated fat, as well as regular physical activity, and if appropriate, weight loss can help improve cholesterol levels. Lastly, let's talk about glucose. Glucose or sugar provides energy for the body to function. However, too much in the bloodstream can indicate diabetes. Insulin is a hormone made by the pancreas that helps move glucose from the blood into your body's cells. If you have diabetes, your body doesn't make enough insulin, can't use its own insulin as well as it should, or both. A high fasting blood sugar, defined as no food or drink for 8 to 12 hours, or a high sugar level 2 hours after meals, can be measured to evaluate risk levels. A fasting blood sugar level of 99 milligrams per deciliter or lower is normal. 100 to 125 milligrams per deciliter may indicate prediabetes, and a level of 126 milligrams per deciliter or higher may indicate diabetes. A level of 140 milligrams per deciliter 2 hours after a meal may also indicate there is a problem with how the body is processing sugar. You can also have your hemoglobin A1C checked to identify your average blood glucose levels over the past 2 to 3 months. Talk to your doctor about ways to manage your diabetes or reduce your risk. Also, if you have diabetes or prediabetes, be sure to learn more about the Diabetes Control Program to get $0 copays for certain medications and free testing supplies.
Thank you so much for tuning in and learning more about your health numbers. Contact your doctor if you have questions or are seeking advice on how to improve your numbers. If you are planning to make lifestyle changes, health coaching could be a beneficial way to set goals and stay accountable.
Scan the QR code or visit the Healthy Connections website to sign up. Take care and stay healthy.